my YouTube family. How are y'all doing? I just want to first let me welcome you guys back for all my previous subscribers. And if you're new here, welcome to my channel. On this channel, I basically talk about nursing video. Well, I make nursing videos. I talk about nursing, obviously. I'm an LPN. I've been an LPN for a little over a year now, but I've been in healthcare for about 16, 17 years, previously working as a medical assistant. So if you guys kind of follow most of my videos, you should know that I had recently started working at a hospital in med-surg unit about 4 months ago. It's been now. It seems like just yesterday, but time really does fly. I just kind of wanted to kind of come to you guys, give you some ideas of what LPNs could do in a med-surg unit. Mostly wanted to talk about the benefits of working at a hospital as a nurse and the kind of skills that you use and the kind of patients that you would see in a med-surg unit. First, I'll start with the benefits. Benefits are usually pretty good working at a hospital. My previous job, I didn't get any benefits at all, and that was at a drug and alcohol rehab facility. There was no benefits. The company was too small, so they really couldn't afford insurance. So I went for like a whole year without any insurance benefits. Luckily, I don't get sick that often. Knock on wood. So I don't really go to the doctor that often, so it wasn't a big deal for me. But now that I have access to benefits, insurance, I've got health, dental. My dental insurance starts in January because we just had open enrollment. And then I have vision, obviously. Can't see. That's why I wear glasses. Another thing, working in the hospital, you get a lot of experience using tons of nursing skills, which I also liked at my last job. Did basic like nursing care there. Every now and then blood draw or whatever. But at the hospital that I work at actually utilizes their LPNs the same way they do their RNs. I do the exact same thing that the RNs do, with the exception of initiating like blood products. I can witness off with the RN when she starts the like if somebody needs a transfusion or something like that. I can monitor the patient for like 15 minutes or however many cycles of that after the patient starts their transfusions, just to make sure they don't have any reactions. I can sign off on it with them. I cannot initiate it as an LPN. And then there's like pushing cardiac meds, IV push cardiac meds. Not allowed to do that as an LPN here in the state of Georgia. However, there are also plenty other nursing skills that you could use besides just those two. You do IV medications, IM medications, PO, rectal, hanging IV medications like normal saline, lactated ringers, antibiotics, IV antibiotics. I do all that. Let's see what else. Inserting Foley catheters, straight catheters. We use bladder scans, obviously, which most facilities I'm sure do. What else? I got my notes over here, so y'all bear with me. I didn't want to forget anything. Let's see. Inserting IVs. I still need practice with that. Not the greatest at the IV insertions. Practice makes perfect. Nobody's perfect when they first start, but then again, there are some that are pretty good at it first try, whatever. For me, most of the time I can get in the vein, and for whatever reason, I guess it's just the patients that I have or what, either their veins blow or I just have a hard time accessing their veins. So usually after I try like 2 or 3 times and I can't get it, I'll let somebody else try. And even then, sometimes, I know it's not just me, it's just sometimes you get it, sometimes you don't. But even then, sometimes the other nurse that tries still can't access the vein. So it is one of those things where the more you do it, the better you get at it. Let's see what else. Yeah, there's a lot of different skills. Obviously, just giving medications in general. Um, but yeah, you get to use a whole lot of nursing skills. Um, a lot of critical thinking. The types of patients you see, mostly in my unit, it's a small hospital, so the people that usually come up to the floor are this is almost repetitive. We get a lot of CHF patients, a lot of COPD patients. We get COVID patients. Sometimes the last couple of months though, we really haven't had that many. Obviously, COVID numbers are down. I think we've had in the last 2 months 2 COVID patients. So sometimes I get to work with them, giving them all of their medications that they normally get. A lot of the times they'll get medicine for cough, like Tessalon pearls, or and then they get the remdesivir. That medication is a hit or miss. It's prescribed for the COVID patients, but I don't think anybody really think that it works. Give it to them anyway. Usually go like a 5-day course of that, and then if they're not, usually they're for the most part better by then. Another thing with our COVID patients at our particular hospital, they've changed a lot of the rules. So if there's a COVID patient and they're having issues with their breathing and it gets worse and they keep declining, it was that if we had to start the patient on Airvo, which is like a high flow oxygen, we'd monitor them for a day or two and kind of let the doctors know that the patients have been put on Airvo. And then if the patient still declines and they need to be intubated, our hospital, we've got a sister hospital that's about 40 minutes away. Same name, just a different location. If the patient has to be intubated, then that patient gets sent out to the main hospital where they have ICUs and they can better care for the patient. We don't have enough staff. Obviously, staffing is an issue everywhere right now, but we just don't have the manpower to watch those patients, because those types of patients obviously need to be in ICU. We do not have an ICU at this particular location, and then most of the time we'll have like 5 or 6 patients, and there's no way that you can give that one patient the proper care if you've got 5 other patients to see. So that's why we usually end up sending them out to our main hospital so that they can be admitted to ICU. Another thing you'll see, well, that we have at our hospital, we've got swing bed patients, which are usually there for like physical therapy and occupational therapy. Most of them have had surgery and they just need strengthening, so they'll be admitted as a swing bed. We get a lot of what they diagnose the patients with is encephalopathy, but the majority of the time it's just a patient that has abused alcohol or illegal drugs and things like that. A lot of alcoholics, I guess you could say. Those patients need a whole lot of monitoring because they tend to try to get out of the bed a lot, and the majority of them are unstable when they stand, so they fall. A lot of fall risk issues with that. We have to move those types of patients to like closer to the nursing station so that we can monitor them, trying to keep them from falling and cause other issues, which we've had one issue in the past, but I'm not going to go into that. Wasn't my patient, but you know. We get a lot of post-op patients, patients that have had total knee replacements, total hips, things like that. And obviously they come in, usually they're there for like 24 hours, just for monitoring and giving antibiotics if they need it, just to make sure that there's no infection after they've had their surgery. We get some observation patients, depending on what the issue is. We just kind of monitor them 24 to 48 hours, and then we discharge them and send them home. We get a lot of patients with generalized weakness, high blood sugars, like hyperglycemia, hypoglycemia, where their sugars are like way too low. We get a lot of patients with chest pain, AFib, and we get some patients that are usually there just for pain control. Sometimes those are the patients that have what's it called, leukemia or something like that, or some other kind. I can't think of it off the top of my head right now. I just drew a blank. But sickle cell, that's it. Sometimes there'll be patients that come in for sickle cell crisis, and they'll just come in for pain control, and then every now and then they'll be put on a PCA pump. I think I've only had one patient that I've had to monitor with the PCA pump. A little annoying as far as the first couple hours, because you have to monitor them every 2 hours, and then you have to go in the room, see how many times they press the pump for pain medicine, and then reset the machine. So you have to do that like every 2 hours. But I mean, it gives you experience with using PCA pumps, obviously. And then like with the IV medications and things like that, you get experience using the pumps. Now, the pumps that we use are the Plum 360s. They used to have the Alaris pumps. I've seen them, maybe worked with them once or twice, maybe when I was in clinicals. But I didn't have to work with them at the hospital, because I guess they had them however long ago, and then they decided that they wanted to switch to the Plum 360 IV pumps. Those are the most finicky and annoying pumps I have ever seen. Obviously, you know, when you're doing IV medications that you have to prime the tubing. Sometimes if the machine still won't work, it'll say whether it's occluded. Then you just kind of have to check their IV line. Sometimes blood comes back in their IV line, and then you just flush it with normal saline, make sure that it's flushing well, and then try to restart the pump. And then sometimes it'll start beeping again, and then you can't figure out what's wrong with it, and then you have to open it and close it and prime it again. And then sometimes every now and then there'll be air in the line, and then you have to let the air out. It's so annoying and very tedious, and sometimes I'm in the room for like 10-15 minutes trying to figure out why the pump's not working. And then eventually, after I've done the same thing over and over again at least 3 times, it just starts back working, and it's fine. But needless to say, you do get a whole lot of experience working at the hospital. So for any of you that might be interested, I know a lot of places and a lot of states don't hire LPNs, apparently, as I've seen like on other YouTube videos or from other like subscribers or whatever. But here in Georgia, they are hiring LPNs. They've been hiring LPNs for a while now. And you can pretty much work in any department just as you would if you was an RN. So that's just to give you guys a little something to think about, kind of give you an idea of the experience that you might gain working at a hospital, some of the skills that you might use. And of course, each department would probably be different, but that's just the med-surg department. That's where I work, so I can only give you advice on what I've experienced so far. But yeah, everything's been going good. Every now and then I get a patient that's difficult. Last week a patient hit me. That was one of those encephalopathy patients that drinks. He was like positive for alcohol and cocaine or whatever it was. I don't know. Last week, was it last week? What's today? Today's Monday. Saturday night, I had a patient. He was a swing bed. There for rehab. He had hip surgery. He was complaining that he was constipated and impacted. And I know at some hospitals, I've heard nobody really does like a disimpaction, where you take your finger and you kind of scoop out the poop, basically. Some hospitals don't do that. Our hospital does. But after I spoke to some other nurses on this Facebook page that I follow, they said that their hospitals don't allow the nurses to do that anymore, because it could cause like a vagal nerve stimulation, and cause a patient to have a heart attack. So I don't know how comfortable I'm gonna feel if I have to do that again. I probably won't, just to cover myself. But I know that I've done it one other time at my hospital, and a couple of the other nurses have done it before. So I'm just gonna kind of check with my manager and see what the protocol is on that for future reference. But I had to disimpact the patient. It's not a fun thing. Just say that. But that's one of those nursing skills that you figure out how to use when you're working in med-surg. Okay, so that's basically it. I try not to make the video too long. But if you guys have any comments, make sure that you comment down below, and make sure that you hit the notification bell to make sure you don't miss any more of my videos. And if you have a request on something that you are concerned about, or just questions that you want to ask, feel free to do that. I do try, I don't have a whole lot of subscribers, obviously. I'm still new at this. However, if you comment or you ask me a question, I'm gonna respond. So if you guys have any questions for me, feel free to ask me. Other than that, I will check back with you guys later. You guys have a good one. Bye.